So we're doing this employer meeting, right? And we tell them, look, we can actually help you buy surgeries differently. They're kind of interested and excited. So at the end of the meeting, this guy walks up and he's like, I have an appointment to have my knee scoped on Wednesday. Could you help me find it less expensive? So I picked up the phone, I called a freestanding medical clinic over in Charlottesville. The CEO answers his personal cell phone. I say, hey, I'm sorry to call on your personal cell phone, but I've got a question. Is there any way we could try to fit a guy in for a pre-op appointment tomorrow to have his knee looked at to see if he really does need it scoped? He sticks his head out the door, calls the orthopedic surgeon who happens to be walking by, and we're able to fit him in. So he goes from not knowing what it's going to cost, probably over $12,000, to only having to pay $1,200, and he saved his employer $7,000. And if we can get doctors to understand that there's a whole section of the population out there that pays for their own claims, that these employers pay all their own claims. And that, I think, is probably, the next step down the road, is as more providers understand there's a different way to help them finance their business, we'll have more and more that say, yeah, I'd be willing to contract with you to provide my service for a fair price. And all of a sudden, everybody starts to understand what it costs. And once we understand what it costs, now we're making better buying decisions, which means the cost of insurance does not have to go up double digits every single year.